Hi there. Nice to meet you. How are you today? Okay. My name is Dr. Mad. I'm going to do the medical exam on you. First, before we begin, I would like to verify your first and last name and your date of birth. Perfect. So I see here that I have the right chart. And can you please describe some of your symptoms? Okay. 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 I see. From what you're describing, you definitely need a cranial nerve exam. I'm gonna make sure that I hit every single nerve and I examine you very thoroughly. But before we begin, I just want to make sure that I have all the information necessary to make the right diagnosis. Okay. Have you been having any headaches? Okay. And how frequent are they? And have you been taking any medications for that? How many milligrams? Okay. Did you have any head injuries? How long ago? Okay, so around 1 to 2 months ago. Do you remember if you lost consciousness? Okay. And did you go to the emergency room? No. So you were able to just stand up and walk back home? Are you experiencing any dizziness? Okay. Any convulsions? Are you having any tremors in your fingers or your hands? Any recent weaknesses in your hands, in your feet? Okay. And are you experiencing any numbness or tingling sensations? Is that only on the right side? Okay. Well, I can definitely tell that you have no difficulty speaking, so I'm going to go ahead and scratch that. But are you experiencing any difficulty swallowing? Okay. And besides ibuprofen, are you taking any other medications, such as for seizures? Okay. So what you're saying is that when you get up suddenly, you have to stay a moment because you get dizzy. Okay. Okay. Also, any neck injuries? Any spinal injuries? Okay. And are you having any pain in your neck or any swelling? Okay. Any surgeries in the last 12 months? Okay. Any new allergies? So I see here that you have no allergies. In case we do prescribe some medications, I want to make sure that I'm not prescribing something you shouldn't be having. Okay. Perfect. So let's go ahead and begin, okay? I'm going to need you to stay as comfortable as possible. that would be great. And is this your first time having a cranial nerve exam? Yes. Okay. Well, I would really love to explain a little bit what's going to happen. I would really like to test all 12 cranial nerves. The cranial nerves are interconnected inside the cranium in your brain, and they all go down to the body to different organs. And by testing different senses, I will be able to find out if there is a damage to any of the cranial nerves. Okay. Mainly, I will be testing your senses such as smell, taste, muscle strength, reflexes, hearing, and vision. Yeah, so I include a little bit more, but the 5 senses for sure. Okay. Well, before we begin, I would really like to take your vital signs. I want to make sure that I have the whole picture. Okay. So I'm going to put this inside your ear. Go ahead and relax. Okay. Perfect. 99.1. It's perfectly normal. Don't worry about it. And have you had any difficulty breathing lately? Or did you feel that your heart rate was elevated? Okay. Any chest pain or palpitations? Great. So what I'm going to do is I'm going to put the pulse oximeter on your finger. Go ahead, just extend your index. That's perfect. And relax for me, please. Good. Can you take a deep breath in? Okay. Perfect. Okay, it's coming out right now. Great. So your heart rate is 96 and your oxygenation is 97 percentile on room air, which tells me that you're breathing very comfortably and you're not anxious and your heart is not working too much. Okay. I'm gonna go ahead and check your blood pressure next. Do you have an arm preference? This one? Okay. So just go ahead and pull your sleeve up. Good. Perfect. Okay. Okay. And do you mind holding the monitor for me? Great. Thank you. Okay. Now, I did look at your medical history and it just shows an elevated blood pressure, but only when you are at the doctor's office. I know this is very, very normal. For you. Okay. So I'm gonna need you to take a deep breath in before I begin, okay? I want you to be as relaxed as possible so that we don't get a false elevated blood pressure. Okay. So go ahead and relax. And take a deep breath in through your nose. Hold it for 1, 2, 3, and slowly breathe out. Okay. Well, that should help a little bit. So let's see. Good. pressure was a little bit better today compared with the other days. Yes. And since I have my stethoscope out, can I listen to your heart and your lungs? Okay. So I'm going to ask you if it's okay to put the stethoscope underneath your shirt. Okay, thank you. Perfect. So go ahead and just relax for me, please. Okay. Okay, very good. I'm not noticing any abnormalities. Your heart rate is very irregular, and I can only hear S1 and S2. I'm not hearing any extra sounds that would concern me. I'm gonna go ahead and listen to your lungs now. Is it okay? Okay. Can you please take a deep breath in and exhale every time I touch you with a stethoscope, okay? Perfect. So go ahead and relax for me, please. Good. Again, take a deep breath in. And exhale. Good. Take a deep breath in. And exhale. Perfect. One more time. Take a deep breath in. And exhale. Okay, very good. Excellent. Okay. Okay. Is it okay if I listen to the back as well? Thank you. Okay, go ahead and take a deep breath in and exhale. Very good. Take a deep breath in and exhale. Good. Take a deep breath in and exhale. Excellent. And one more time. Take a deep breath in and exhale. Okay. I'm gonna go ahead and put some gloves on. Are you having any pain right now? No. Okay. And are you experiencing any tingling sensations behind your head, down the spine, or lumbar right here above your... Okay. So no, that's perfect. No worries. What I'm going to do now is I'm going to palpate your head. I'm looking for any lumps, for any, abnormal growths, also for tenderness, okay, and sensitivity. So is that okay? Okay, perfect. So go ahead and relax for me. Good. So I'm not noticing anything abnormal. Now, is it okay if I palpate your face? Okay, let me know if you're feeling any kind of pain. Can you please clench your jaw for me? relax and do that one more time. Clench your jaw. Good. Okay. So I'm not hearing any popping sounds. Are you feeling any pain when you do that? Okay. Can you please open your mouth like this? Good. And I'm gonna try to close it. Don't let me do that, okay? Perfect. Okay. Can you please give me a big smile? Excellent. Now go ahead and frown. Okay, good. Can you please puff your cheeks for me? Just like this. Perfect. Can you please keep them puffed and don't let me unpuff them? Perfect. With your tongue, can you please push in inside your cheek? Like that. Okay, good. And do the same thing on the other side. Okay, perfect. I'm gonna go ahead and palpate your jaw. Let me know if you feel any kind of sensitivity. Any pain there? Good. Okay, wonderful. Okay, next I'm gonna go ahead and make some movements with your head. Let me know if you feel any kind of pain, okay? So just relax your head right here. Good. And we're gonna go ahead and turn to the right. Good. And to the left. Perfect. And we're going to move down. Good. That was a little bit too hard. And we're going to move back up. Okay. That looks very good. I'm gonna try to move your head this way. Don't let me do that, okay? Okay, good. And I'm gonna try to move your head the opposite way. Don't let me do that. Okay, good. Can you please close your eyes? Good. And now try to keep them closed as much as you can. I'm gonna try to open them. Don't let me do that. Very good. Now go ahead and open your eyes. Okay. Can you please lift up your eyebrows? Just like this. As much as you can. And I'm gonna try to lower them. And don't let me do that. Okay. Very good. Let's go ahead and check your taste first, okay? To insert one drop. I'm going to put it right here on your tongue. Can you please tell me what that tastes like? Okay. That's good. Now I have here a green solution. Let me go ahead and mix it really well. I want to make sure that it has the right concentration. And none of the substances are harmful, especially because I'm only, inserting just a few drops. Go ahead and open your mouth. Good. Can you please tell me what that tastes like? Good. You're right. It does taste like hand sanitizer. Okay. Now I'm going to check your taste for sweetness. So again, this will be a sweet fruit. It's very flavorful, and I know for sure that you're not allergic to this, so just give me a big Good. Black cherries. Very good. Excellent. Okay. I have here one more. I'm going to put a drop on your tongue. What does that taste like? Tastes like coffee. Very good. So you can taste everything appropriate. Now, before I even try to check your sense of smell, I'm gonna go ahead and just palpate your nose. Please tell me if you feel any kind of pain, okay? I want to make sure that your nose is patent, which means that you can breathe normally without any obstruction in both ears. Okay, that's very important before we even start the smell test. So go ahead and relax. I'm just gonna go ahead and just palpate your nose. Good. 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 And it seems like you're not having any pain. I'm gonna go ahead and just close one ear. Can you please breathe in, breathe out? Good. And I'm gonna do the same thing on the other side. Obstruct the other ear. Now please breathe in, breathe out. Perfect. Okay. I'm not seeing any obstructions there. But just to make sure, I would really like to take a look with my otoscope. Can you please look up for me? Perfect. I'm going to insert this in your nostril individually. Okay, good. And let's go ahead and check your other nostril as well. Perfect. Everything looks very good. Okay. So what I'm going to do first is I'm going to ask you to close one nostril for me. Good. And try to take a deep breath in through the nose and just identify this smell. Good. Yes, it's very hard to distinguish, but it is definitely a combination between eucalyptus and other flowers. Okay, we're gonna do the same thing, but now I need you to obstruct your other nostril, okay? Good. So go ahead. Take a deep breath in through the nose. Perfect. What does that smell like? Okay. Wonderful. You're right. It does smell like paint. It's not a very pleasant smell, but I'm glad that you are able to distinguish it. Now, this one is definitely a smell that you will enjoy. Okay, for this, I'm gonna have you keep both nostrils open. Okay, and take a deep breath in through the nose and make sure that you think really hard about what kind of essence this smells like. And breathe. Good. And exhale. Good. Okay. Yes, you're right. It does smell like lavender. Okay. I have one more, and it definitely smells really good, so you're going to enjoy this. Okay, I'm going to ask you to do the same thing, to take a deep breath in. And again, take a deep breath in. Good. Smells like lemons. Perfect. Okay. Now, I definitely don't want to wake you up. Probably you're feeling very relaxed, but this is one of my favorite smells, so I have to ask you to see if you can identify it. Okay? Alright. Can you please do the same thing for me? Take a deep breath in through the nose. It's very easy, right? I agree with you. Okay, that smells like coffee. Okay, good. I'm gonna go ahead and check the inside of your mouth now. And first I want to make sure that your gag reflex is intact. Okay, so go ahead, give me a big ah. I'm going to insert this wooden stick inside your mouth just for a little bit. Okay, good. Can you say ah? Good. So I'm definitely noticing that your uvula is midline, tongue is symmetric. I'm not noticing any abnormalities, no lumps. Very normal color. Your lymph nodes are not enlarged. And can you please move your tongue up and down? Up and down. Good. And now side to side. Perfect. Okay, so very good muscle coordination there. Okay, I'm gonna go ahead and take a measurement of your head circumference. So go ahead and relax for me, please. Okay, very good. Okay. Next, I'm gonna go ahead and check your hearing. Any problems with your hearing? Okay. So let's see what is happening, okay? First, I'm gonna go ahead and just inspect, make sure that visually there are no abnormalities. Good. Good. I'm just going to come a little bit closer. Good. Okay, I'm not seeing anything abnormal. But now I'm gonna go ahead and just palpate the tragus, which is the cartilaginous part of your ears. Let me know if you feel any kind of pain, okay? Any pain when I palpate here behind your ear on the masseter bone? Okay. Perfect. Is it okay if I take a look inside your ear? Okay. So go ahead and relax. This is going to be very painless. Okay. Wonderful. Well, the good news is that I'm not seeing any excess fluid, no signs of any cerebrospinal fluid, and tympanic membrane looks to be very intact. Just a little bit of pinkishness, but otherwise looks very normal. Is it okay if I take a look inside your other ear? Perfect. Okay. Any pain? No. Good. Same thing here. Tympanic membrane is pearl gray, translucent. Normal vibrations. I'm not seeing any signs of infection. And also no signs of cerebrospinal fluid. Okay. So I'm gonna go ahead and check your hearing next. This is called a tuning fork, and I'm going to perform 2 tests today. One is called the Weber test, and the other one is called Rhine test. So let's see. What I'm going to do is I'm going to strike the tuning fork and create a vibration sound. I'm going to put it right here behind your ear, and I'm going to need you to tell me when you don't feel the vibration anymore. Sounds good? Perfect. Okay. So go ahead, tell me when you don't hear it anymore. Okay, good. What about now? Excellent. I'm going to do the same thing on the other side, okay? Okay, now. Do you still hear it now? Perfect. Okay, now I'm gonna need you to tell me which position here is louder. Position number 1 or position number 2. Okay, so this is position number 1. Okay, and this is position number 2. Okay, good. Definitely number 2. That's the correct answer. And same thing on the other side. This is position number 1. And this is position number 2. Definitely number 2. Perfect. Okay. What I'm gonna do next is I'm going to check your sensation on the outside of your ears. Okay. So what I'm going to do is I'm going to just gently touch you, and please tell me where you feel it. Okay. Perfect. Good. What about now? Perfect. I'm going to do the same thing on the other side. Tell me where you feel that. Good. What about now? Okay, perfect. Okay, go ahead and close your eyes. I'm going to create some sounds in each ear, and I need you to tell me with which ear you hear the sound, okay? So go ahead and close your eyes. Good. What about now? Perfect. Okay, what about now? Excellent. Now I'm going to keep on making sounds. Can you please tell me when you don't hear them anymore? Now, good. What about now? Good. What about now? Perfect. Okay. Same thing, I'm going to create some sounds on each side of your head, like on each side of your ear. And please tell me with which ear you hear this sound, okay? Go ahead, close your eyes, please. Good. Perfect. Wonderful. Okay. I'm gonna go ahead and cover one ear for you, just like that. Good. And now please tell me when you don't hear the sound anymore, okay? Now, good. And I'm going to do the same thing on the other side. I'm going to cover your ear. Please tell me when you don't hear the sound anymore. Now, excellent. Okay, I'm gonna go ahead and do a whisper test. Have you ever had done? Okay. I'm gonna go ahead and do a whisper test. Have you ever had one before? No. Okay, so it's very easy. All you have to do is just pay attention to the words that you hear and repeat them back to me. Okay? Great. So what I'm going to do is I'm going to cover one ear for you and I'm going to whisper in your other ear. Okay? So let's go ahead and start with this one. And I'm going to say something. Sensory brush. Perfect. Okay, I'm going to do the same thing but on the other side. Okay, good. And now I'm going to go ahead and whisper. I have a red watch. Great. Everything seems to be intact. Okay. I'm gonna go ahead and check your facial sensation next. Okay, perfect. Great. Can you please close your eyes and tell me where you feel this on your face? Okay? Good. What about now? Perfect. What about now? Excellent. And here? Excellent. And on the other side? Perfect. Okay. Go ahead and relax. Tell me if you feel this on your face. Good. And here. Good. And here. Perfect. And did you feel that equally on both sides? Okay. Perfect. Okay, what I'm gonna do now is called sharp or dull. And I will show you in just a second what sharp really means, because it's not going to be sharp. It's just a different texture. Okay, so go ahead and extend your palm. Good. Okay, so this feels sharp, right? Perfect. And this will be dull. Wonderful. So same thing, I'm gonna have you close your eyes and tell me if you feel sharp or dull. Sharp, good. Sharp, perfect. What about now? Sharp, good. What about now? Dull, good. What about now? Dull. Okay, let's try I'm not concerned at all. Okay, I'm gonna go ahead and check your eyes next. Have you noticed any problems with your vision? No. Okay, well, in that case, I would like to assess your pupils first. Okay, so go ahead and take a look right here at my nose without moving your head. Just keep on looking at my nose. Very good. And try to keep your eyes open. Perfect. What I'll do is I'll flash a light in your eyes. I apologize for that in advance. Okay, so go ahead, keep on looking at my nose. Good. Same thing on the other side. Keep on looking at my nose. Good. And now can you please look up for me? Good. Good. And now can you please look down? Good. And same thing on the other side. Look down. Okay. I'm going to swing the light in your field of vision. Can you please follow the light? Good. 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 And I'll do it the opposite way. Follow the light. Good. 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 Okay, perfect. Good. Good. Wonderful. Okay, I'm going to put my finger right here on the light. And without moving your head, I'm going to need you to follow my finger or the light only with your eyes, okay? So let's go ahead and start from here. And we're going up slowly, slowly, slowly. Good. And back to middle. And we're going to shift to the right. Okay, good. And now we're going to go up. Perfect. And now we're going to go down. Good. And now we're back to center. And we're going to continue going to the right. Good, good. And we're going to look up. Good. And we're going to look down. And we're going to look back to the center. And I'm going to meet you right here. Perfect. Okay, I'm going to turn this off. Okay, first, can you please look at my nose while I approach this pen very close to your eyes, okay? Keep on looking at my nose. Good. Okay. And now I need you to look at the pen, okay? So go ahead. Keep on looking at the pen while the pen is approaching your field of vision very, very close by. Good. Excellent. Okay. Now I'm going to go ahead and divide your field of vision into half. So I think that looks good. Okay, I'm going to flash the light in one eye and look at the other one. Good. I'm going to do the same thing on the other side, so that looks very good, very even. And I'm going to do the same thing. I'm going to flash the light in this eye, and I'm going to look at the other one side. Okay, perfect. Okay. Can you please tell me what color this is? Green? What color is this? Yellow? And what color is this? Red. Perfect. Okay. We're going to check your peripheral vision and also your eye movement. Okay. I need you to follow the red ball and don't let yourself distracted by the yellow ball. Can you do that? Okay. So go ahead. Keep on following the red ball. I'm gonna go ahead and switch. Good. You're doing wonderful. And I can definitely tell that your eyes are getting tired, which is normal, and I'm just trying to see how your vision changes during stress. Okay. So far, I'm not noticing any abnormalities in your eye movement. Okay, perfect. Next, I would like to check your visual acuity with the Snellen chart. So let's see. This one is a little bit too far. I think this would be more appropriate, okay? Can you please tell me what letter this is right here? Perfect. What letter do you see here? J? Can you please read the last row starting with this letter? Good. Great. Can you please tell me what color this is? Red. And what color is this? Green. Can you please tell me what number this is right here? 5. And what number do you see here? 4. And can you please tell me which circle is smaller? The circle underneath number 2 or the circle underneath number 3? Okay, wonderful. I'm gonna go ahead and check your color vision, and I want to make sure that there's no color deficiency. We're gonna start with the first picture. Can you please tell me what number you see here? Number 12. Good. Okay. And what number do you see here? 8. Perfect. What about here? What number do you see here? 6. Okay, this is too easy for you. Okay, let's go ahead and try some bigger numbers. Can you please tell me what number do you see here? 15. And what number do you see here? 74. Okay, so that was very easy as well. Alright. Can you please tell me what color this is? Good. And can you please tell me what color this is? Perfect. Okay. Wonderful. Can you please tell me what number do you see right here? You don't see any. Good. And what about here? Can you see a number? Okay. Great. No concerns there. Okay, this will be very easy. Can you please follow the line starting from here all the way back here? Great. And we'll do the same thing on the other side. Perfect. Okay, let's see, what else do we have? Okay. I think you convinced me that you have no color deficiency. And what I would like to do next is to check your vision, your ocular nerve. So I'm going to ask you to look right here behind me. Okay, perfect. And try to keep your eyes as open as you can. I'm going to flash a light in your eyes and ask you to take a deep breath in and hold it. Okay, so pinch your nose and close your mouth. Okay, so go ahead and relax. Good. Perfect. No problems there, no signs of inflammation. Ocular nerve is intact. Can you please look up for me? Okay, good. And now can you please look to the left? Good. And to the right. Good. And can you please look down? I'm just gonna go ahead and I'm going the same thing on the other side, so go ahead and take a deep breath in and exhale. Good. Are you ready to examine your other eye now? Okay, so I'm going to ask you to do the same thing. Go ahead and look right here. Great. Good. Just don't want to hurt you. Perfect. Okay. Looks very good. No scratches. Retina looks very clear. Okay. Can you please look up? Good. And now look to the left. Good. And to the right. Good. And down. I'm gonna go ahead and just lift up your eyelash. Perfect. Okay, go ahead and breathe in and breathe out. Okay. Excellent. Okay, I'm just gonna go ahead and write down everything that we did today. I will also verbalize and tell you the results. Okay. Good. Also, you're definitely alert and relaxed, and you're very cooperative. There's no doubts there. You sound very coherent, and you're also oriented to person, place, and time. Okay, you don't seem to look in any distress, and overall, it looks like you have very good grooming and appropriate hygiene. Excellent. Okay, your olfactory nerve, which is the smell nerve, seems to be intact. You were able to identify all the smells. Okay, and your visual acuity is good bilaterally, 20/20. Okay, your visual fields are full to confrontational in all 4 quadrants. And your pupils look 3 millimeters in size. They are reactive and accommodating to light as well. I was not able to see any ptosis, which is like drooping of the face, and your eyes are also even, and your visual fields are intact. Your motor side is intact as well. The jaw is midline, and I was not able to notice any abnormalities during mastication. Okay, facial expressions were bilaterally equal. Okay, you did have an intact gag reflex, and your uvula was midline and symmetric. Also, we did do the shoulder shrug, right? And that was also appropriate. Okay, looks like we missed the reflexes. We didn't check that, so we can definitely do that before you leave. Okay. Facial sensation was also normal. You were able to feel all the vibrations. And motor-wise, you are able to do all the tests. Okay, so I do have a few more tests that I think I missed, and I really don't want to miss them. So we're gonna go ahead, since I remember to do them, we're gonna go ahead and do them, okay? One of them is, I'm gonna have you do some movements with your hands. Okay, perfect. So go ahead and put your palm like this. Great. And with your opposite hand, I'm gonna need you to perform this exercise. Okay, so go ahead, you do it. Okay, very good. Perfect. Just like that, yes. Good. And now let's go ahead and switch hands. So the same thing. Perfect. Very good. Okay. Now, can you please, with your finger, I'm gonna need you to touch your nose and then touch my finger, okay? I'm gonna keep moving my finger in all directions, and I need you to pay attention and just keep on doing this, okay? So touch your nose and then touch my finger. Okay, let's go ahead and begin. Touch your nose. Good. And now go ahead and touch my finger. I'm gonna do it with you, okay? Good. Perfect. Good. Good. Perfect. Excellent. Very good. Wonderful. Okay, let's go ahead and switch fingers, okay? So now we're going to use the opposite hand. Same thing. Go ahead. Okay. Try to look straight. Yeah, perfect. Just like I'm doing it. Okay, wonderful. Okay, good. Good. Okay, perfect. The final thing that I would like to check are your reflexes. And I'm going to start with your face, okay? And then just slowly move down the body. First, I need you to relax your jaw. Just like this, slightly open. Perfect. And I'm gonna slowly tap on your jaw. Make sure that I'm eliciting the right reflex. Great. What I will do now is to slowly tap on the bony prominences of your face, okay? So go ahead and relax. Good. Okay. Good. Good. Perfect. So far, everything looks very healthy. I'm gonna go ahead and start with your right arm, okay? Good. Good. Perfect. And your wrist. Wonderful. Let's go ahead and switch. Good. 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 And your wrist. Perfect. Okay. I'm going to move down to your knee and then your Achilles. Great. And all the way down. Okay, to the Achilles point. And I'm going to do the same thing on the other side. So just relax your feet. Okay. Good. Excellent. Okay. Wonderful. Everything looks very good. I'm not noticing any abnormalities. Do you have any questions for me? Okay. Well, there's no need for the nurse to come in today. But, yeah, definitely. Okay, I'm gonna have her come in just to say hi. Okay. And thank you so much for allowing me to do this cranial nerve exam on you. It was really a pleasure. Great. Well, I'm going to ask you to take care of yourself and try not to injure yourself just so you come in my office. Does that make sense? Perfect. Okay. Well, you have a wonderful day. And say hi to your mom. Great.